For decades, we've told the story of obesity with just one number. But what if that story is completely wrong? Or at least incomplete? Today, we're diving into a huge shift in how the medical world is rewriting the playbook on obesity. We're moving from a simple number on a scale to a much, much deeper understanding of health. So let's just get right to it. That one number? It's the body mass index. You know it as BMI. For years, it's been the go-to metric for everything. But now, there's this critical question being asked in doctors' offices and research labs all over the world. Is BMI times really the best way to measure someone's health? And the answer? Well, it's complicated. And you can really see the problem right here on this slide. On one side, you've got BMI. It's just a simple math problem, your weight versus your height, but it's kind of like using a hammer for surgery. It can't tell the difference between muscle and fat. And maybe most importantly, it completely misses that dangerous visceral fat, the stuff hidden deep around our organs, which is a way better predictor of our actual health risks. And look, this isn't just some academic debate. A recent proposal in The Lancet really stirred the pot, sparking a major controversy. Some folks were worried it could actually slow down how fast patients get care. So in response, the American Association of Clinical Endocrinology, we'll just call them ACE, they stepped in with a new consensus statement, basically creating a practical playbook for doctors on the front lines. So here's what we're going to cover. First, we'll dig a little deeper into why BMI just doesn't cut it anymore. Then we'll look at the new toolkit doctors can use to get a better picture. After that, we'll see how all this leads to way smarter, more personalized treatment plans. And finally, we'll get real about the hurdles to actually making this happen in the real world. All right, let's kick things off. Why exactly do we need to move past this one single number? So the ACCE is pushing for this really important new term, adiposity-based chronic disease. Now, this isn't just about changing the name. This is a huge deal. It's about reframing the whole conversation, moving the focus away from just the number on the scale and onto the actual health problems caused by having too much body fat. It finally treats obesity for what it truly is, a complex, chronic disease. Okay, so if BMI isn't the whole story, what is? Let's get into the new diagnostic toolkit that can give doctors a much, much clearer picture of a patient's health. Now, what's interesting is that the AACE doesn't just throw BMI out the window. Instead, they've built this smart three-step process around it. Step 1 is to screen with BMI, just as a starting point. Step 2 is to confirm with a physical exam, and this is key. That includes measuring waist circumference to check for that dangerous visceral fat. And then step 3, if things are still a little fuzzy, clarify with more advanced scans. And that second step, it's absolutely crucial. The AACE puts it perfectly here, saying that measuring the waist is a great way to indirectly measure that visceral fat. And it does a much better job of predicting someone's risk for things like heart disease. It's really all about finding those hidden risks. Okay, so getting a diagnosis is one thing, but the new framework goes even further, asking the really critical question. Okay, but how severe is the disease? And the answer to that lies in a simple but really powerful staging system. And you know what? This staging system is actually super simple to understand. Stage 1 basically means you have excess fat, but no related health problems yet. Stage 2 is when you start to see mild to moderate issues pop up, things like high blood pressure or high cholesterol. And stage 3, that's when there's at least one severe complication, like heart failure. This system is huge because it helps doctors figure out who needs the most urgent care. So, with this new diagnosis and staging system, we can finally get to the really exciting part, creating smarter treatment plans that are actually tailored to the individual. This leads to a question pretty much every patient asks, right? How much weight do I actually have to lose to see a difference? Well, these new guidelines give some really concrete answers, linking specific weight loss targets to real health improvements. And just look at this breakdown. The ACE gives these clear, science-backed goals. So if you're trying to lower your risk of a major heart event or improve something like sleep apnea, the target is at least a 10% weight loss. But for things like osteoarthritis or GERD, even a 5 to 10% loss can make a world of difference. These are real, achievable goals that tie weight loss directly to feeling better. But it's not just about lifestyle changes. This next part is a really big deal, a first-of-its-kind thing. The new guidelines actually introduce a structured hierarchy for obesity medications. We're finally moving past that old one-size-fits-all approach. Seriously, this is a total game changer. For patients who also have conditions like type 2 diabetes or heart disease, the guidelines say to prioritize the newer, more powerful meds like semaglutide and tirzepatide. For folks in the earlier stages, some of the older medicines might still be a good option. But for patients in stage 3, the ones with severe complications, the guidelines strongly recommend those newer second-generation drugs. Now, this all sounds great in theory, right? A smarter, more personalized approach. But putting it into practice, well, that's where the real challenges begin. So let's talk about the final piece of this puzzle, the real-world hurdles. The thing is, BMI is just everywhere in our healthcare system. It's totally baked in. It's cheap, it's fast, and it's already built into all the software. To change that takes a massive effort. I mean, you need everyone, medical groups, government, insurance companies, to get on the same page. You're talking about retraining entire clinical staffs, rewriting textbooks for medical school, and redesigning all the electronic health records. These are not small bumps in the road. And for the doctors who are actually seeing patients every day, the hurdles are very real, and they're happening right now. Just getting insurance to approve these newer, more effective medications can be an absolute nightmare. And finding the time in a jam-packed schedule for deep counseling, that's a constant battle. Any new system has to be practical enough to work in the trenches. So where does that leave us? Well, we have a new, much smarter playbook for obesity care, one that actually puts a patient's total health front and center. It could absolutely revolutionize how we treat this disease. The real question isn't whether this is a better way forward. It clearly is. The billion-dollar question is, how fast can the entire system actually adapt?